Hi everyone, my name is Ashley if you have never been here before, and I'm a third-year veterinary student at St. George's University. This week I'm going to take you along with me so you can see what it's like to be a veterinary student in their third year of vet school, because it definitely is very different from what first year and second year looks like. This week in particular, I do have two types of rotations that I'm doing on top of my didactic lectures. So let's jump into the video, and I do hope you enjoy this week's video. If you do, please give it a like and subscribe for more. For today, I do have 4 hours of lecture this morning, and also I am doing a NAVLE prep session for my boards preparation class, and that's an additional hour, so total of 5 hours of lecture today, which isn't too bad. Some days I've been in class from 8:30 in the morning until 5:30 at night, and then actually coming up next week, I will be in class from 8:30 until 8 p.m. I also have to do a couple of emails today and finalize some things for a scholarship that I'm applying for clinical year, and it's about 1 week away from midterms, and I have not studied at all. So this week, I'm going to actually start studying for these exams because we have no other grades going in. We just have the midterm and the final exams. It is around 7:40 in the morning, so I am actually going to head to class now because my first lecture starts at 8:30. I am back from campus. It's been a while since I've last talked to you, and a lot of crazy things were just going on today. But class overall went really good. We talked a lot about equine neonates. Then we did fracture repairs in horses, and we talked about neurology with livestock in livestock medicine. And then in small animal medicine, we talked about puppy behavior and how to deal with first puppy and kitten appointments. The NAVLE review session went much better than I was expecting because endocrinology is just a hard topic to grasp. But once you start understanding it and understanding the physiology and pharmacology behind it, it actually starts to make more sense. After that, I decided to study at Taylor, and I got pretty much all of my reviewing done from today's lectures. I haven't really studied yet though, so I think that's going to be my next thing, but I am also dealing with trying to figure out housing situations in Virginia for clinical year because I still have no place to live when I move in May, which is kind of a problem. It's almost the end of February. It's just really stressful finding an apartment, and it looks like the apartment that they told us they were reserving for us is going to be taken by someone else because they didn't tell us that I needed to do some more paperwork for them to get my lease approved, even though I've been approved once by this apartment. Apparently they need it again when you switch to a different lease. Kinda wish they had told us that, but they're now closed for the day, so I can't really do anything about that anymore today, so I'm not going to worry about it, and hopefully we hear some good news from the other apartments tomorrow. because we've been having a hard time getting people to respond back to us. I also decided to stay on campus for another reason. They're doing construction in the laundry area, so that's right next to my apartment, of course, so I did not want to listen to all of the construction going on. I also still need to prepare for my clinical pathology rotation, which is tomorrow at 1:30. We are most likely doing cases and doing blood smears and looking at PCV and doing a blood cell count, platelet count manually. And then I think we might be doing some fine needle aspirate cytologies too, just to make sure we understand what we are looking at and how to possibly get to a diagnosis. It's pretty interesting stuff. I do like clinical pathology a lot. It's just kind of a lot of steps to work through each individual patient. So I'm going to review the cases a little bit tonight, and then hopefully I will be ready for discussion in class tomorrow. I'm still feeling pretty frustrated with the whole housing situation, so I think I am going to take a bit of a break because I've been working non-stop since 7:40 this morning. So I think it's about time I take a break and make some food and just relax a little bit. This is already turning into a very long week and it just got started. After dinner, I did decide to take a little bit more of a break because I have been working on my housing situation in Virginia, Maryland for about 3 hours today. It's just a lot to deal with on top of trying to prepare myself mentally for midterms, but the shower definitely helped, and I was actually able to study toxicology for about an hour, so I got some studying done today, which is what I wanted to do. And I also worked through the 3 cases that we were going to be discussing tomorrow during our clinical pathology rotation, so I am ready and prepared to answer some questions that the professor may have. And I did watch a couple of videos earlier on campus that you saw. It is around 10:30 now, so I am going to get some sleep soon because I have another big day tomorrow. I will see you all in the morning. I made it back from campus and today went pretty well. In livestock medicine, we continued on with our discussion of neurological diseases. And then in equine internal medicine, we talked about what type of antibiotics we can use in horses. And in toxicology, we started talking about some toxins that can affect the respiratory system and the urinary system. We definitely learned quite a bit of material today, but honestly, that's what we get every single day. We go through a lot of material. For the clinical pathology rotation today, it went pretty well. We practiced doing blood smears and manual PCVs. And then we also learned a little bit about how to do cytology and fine needle aspirates. It definitely was good. Once our rotation was finished, I did stay on campus for a bit to study and review my classes so I can keep on top of things before our midterms next week, because they are coming up so fast and we are still learning material that will be on those exams. In preparation for my rotation tomorrow in clinical pathology, we are discussing cases. So I reviewed and looked over the cases that I have been assigned to talk about with my group. I am back from campus. It is around 9 o'clock now, so I have been on campus for a little bit today. I did have 4 hours of lecture and also 2 hours of clinical pathology rotations, and that was actually my final clinical pathology course. So honestly, it ended really well. I'm super happy with how that rotation went. I'm looking forward to Friday's rotation, which is going to be radiology. And then I did get exciting news today from an externship, so I won't announce that here. If you want to know what externship I received for clinical year, follow me on my Instagram. It will be on there already. But I will be making a video about all of the externships I received for clinical year, because I had 21 weeks worth of externships to figure out. So it was a long process, and I thankfully only have one more to find. Class itself today went pretty well. It was a little bit boring, but honestly, I'm okay with the slower days because that means that there will be less material, hopefully, on the midterms. Other than that, I didn't do too much today. I ended up staying on campus with some friends for a bit and watching a flag football game. So we really didn't do that much today. I should have studied a little bit more, but honestly, I need to give myself a bit of a break because I'm already feeling the burnout of studying for next week, and I cannot get burned out this soon. I'm pretty exhausted, so I am going to get some sleep now, so I will see you all tomorrow. I am back from class. Today went pretty well. It was another slow day. When I came home, I decided to take a nap because I was pretty tired from this week. Then I woke up and saw I had an email from one of the externships I was accepted to for clinical year, and unfortunately with all of the government changes due to the change of presidency, it was canceled. And it's very unfortunate because that was my 6-week virtual externship with FDA. So that was one of the big regulatory companies in the US that I was hoping to see about getting a job at after vet school. I am highly upset and disappointed, and I know it's not the company's fault. They are just doing what they are told. But I put a lot of time and effort into these externships, so I'm hoping that this won't happen again, but it very well could. It's just scary because this was one of those externships that Virginia Tech works with. Now it makes me wonder, is the public corporate track even happening? So I emailed the university to see if, in fact, the track is still available for vet students. And if it's not, I need to figure out what to do because I have all of these externships scheduled for a specific reason. It fulfills the public corporate requirements. So it is a big deal if I start losing these externships. I won't be able to fulfill the needs of the track. Therefore, I wouldn't be able to graduate. I have not heard a response yet from the university, and I most likely won't this week. I will probably be explaining that in my next clinical year update, because I don't want to get into it too much into this weekly video, because this is specifically supposed to be for a week in my life as a vet student at St. George's University, and not about clinical year. But honestly, this week has been filled with nothing but clinical year updates. It's definitely very frustrating, but I have to move forward. I did apply to 2 externships today, so hopefully I hear some good news from them soon. I'm trying not to focus on this whole situation, but it's really difficult because this has been my dream of becoming a public health veterinarian for a long time, and I have been working towards that goal for a long time. After seeing that email, though, I decided to just take a little bit of a break because I definitely cried after reading that email, because that was rough because I've had this scheduled for months and I don't know how I'm going to fill it with another externship because you usually have to apply a year in advance, and this one is in 2025. It's going to be interesting to see how I'm going to fill that, but I'm going to do my best to research some more externships over the next couple of weeks, and hopefully I can apply somewhere. For school purposes, though, here, I do have my radiology rotation tomorrow. Unfortunately, our professor is not on the island currently. He had a family emergency and he had to go home, but he is doing it completely virtual. So we do have to go to a certain classroom, so it's being recorded and graded. And I believe we are doing some case studies tomorrow on real patients that has been seen at the small animal clinic. So hopefully I remember something from diagnostic imaging last term to hopefully do well on the cases and get my participation points. I am going to go ahead and get started with studying for today, and hopefully tomorrow is a better day and I hear some good news soon. We have officially made it to the end of the week, and today's classes went pretty well. The radiology rotation today went really good. We figured out what our patient had based off of the radiographs. I definitely still need to practice more radiology terminology, but I'm certain with clinical year during my rotation within radiology, I will get plenty of practice. I do hope you enjoyed this week's video. If you did, please give it a like and subscribe for more. And I will see you guys next week. Bye!